Hello, everyone, and welcome to episode 7 of Compass Capital Conversations. 2025 is a special year for Compass Capital Management. This is our 60th year in business. We actually have clients from all walks of life and all ages, but being that we've been in business for so long, we've had many of you as clients for 30, 40, and even 50 years. We've been able to help you save for retirement through all of your working benefits. We've been able to help you even create ways to spend in retirement. The challenge that we have come across is when you're trying to find a place to live that is going to be really what we call your forever home. How are we going to be able to find a place that's going to be able to take care of all of your needs, that is going to be able to transition you? And not everybody has the same requirements. Why this is a challenge is that there are so many different options in so many different pricing models. What we have done through our Partnership of Professionals initiative is we have partnered up with CarePatrol. Now, CarePatrol is a senior advocacy group that can help with situations like this. Today, I want to introduce you to Senior Care Advisor Chris Curran. Chris, I want to thank you today for taking the time to be on the podcast.
Thanks for having me on, Jared. Happy to be here.
It's wonderful to have you, Chris. Give a brief explanation on how you got into this, a little bit of your background, and what gets you excited about doing this type of work.
Yeah, so I've been working with seniors and in senior care since I got out of college almost 20 years ago. Started out working in hospice care, working with end-of-life patients. And that's where I learned a lot about the healthcare system, about hospice, about patient care in general, working collaboratively with nurses and doctors to try and provide end-of-life support for people in the Bronx. That was the most rewarding experience of my life and really shaped my understanding of aging and dying and living. And I worked for a home care agency actually for several years subsequent to that. And that really was an education in terms of what happens in the home following a hospitalization or a hip surgery or a knee surgery or pneumonia for a senior when they go back home and receive benefits in the home and care through their Medicare benefit. I did that for another 6 or 7 years, really learning the ins and outs of skilled nursing, assisted living and dementia care, and how seniors and their families struggle and try to navigate keeping a loved one at home, a senior at home, or someone who's trying to age in place when it's not exactly successful. I've been with CarePatrol now for the last 6 years, and we are local senior advisors, and we help seniors and their families navigate the senior care continuum. I'm like a social worker on the outside of these hospitals and skilled nursing facilities to help seniors and their families understand the options and try to create a path forward and a long-term care plan so that we're promoting safety, quality of life, and preservation of assets.
Let's say there's a senior that needs your help, either being placed or any of the questions that they have about medical care. Give us an idea on what the process is with CarePatrol.
So with CarePatrol, when my phone rings or I receive a referral from somebody, I pretty much do a senior care 101, I call it. Really, I dive in and understand, ask questions. To what extent does the senior or the adult child that I'm speaking with understand their situation and understand the options that are before them? So when I say Senior Care 101, I'm learning about the person's care needs, their budget, and where they're located. And based on those three things, during a conversation that I'm having with somebody, I can figure out, based on their needs clinically and their finances, what could be some good options. It helps me narrow down the search and say, okay, this person is definitely more appropriate for independent living versus assisted living versus dementia care or a nursing home. So some of these factors come into play. Based on their care needs, based on their finances, we help them understand options. Maybe it's home care, maybe it's skilled nursing. It really depends on everybody's individual circumstances.
What happens from there? How do you facilitate this from the starting point to the finish?
So after our initial conversation, I will follow up with the family and provide some potential senior living options. We will then go and tour those options together. Think of me as like a real estate agent, but for seniors specifically. I understand the communities, their care capabilities, their pricing models, where they may fall short, and where their care capabilities can extend to. So we tour together with the family. I'm that advocate for them while they're meeting with the salesperson, so making sure that that salesperson doesn't overpromise and underdeliver. I'm there through the whole process, A to Z, even after they pick a community. Let's say we go to 3 or 4 and they decide on community A or B. That community is going to do an assessment of mom or dad or the individual, and we're going to go forward to understand what the final pricing is going to be and what the final logistics are going to look like. I help with move management, and then even after following a move, really making sure that after 30, 60, 90 days that they're having a good experience, that their care needs are being met, that everyone's kind of on the same page, and that it's a really successful placement. The family's happy, the community's happy, and the individual living there who needs the care and support, they're happy in getting what they need.
What would you say are the top considerations when evaluating any of these senior facilities?
The care capabilities, really, what are they able to do so that enabling someone in Connecticut to age in place? Every state is a little different in terms of what their licensure allows them to do from an assisted living standpoint, or if it's independent living or dementia care. So really understanding the care capabilities, not just on paper what they say they can do, but what they're actually able to do through experience and working with them over time. Also, finances, you got to understand what the pricing model is and how the care cost is going to increase over time. A place may look great because it's X dollars a month, but if they're going to increase over time a lot more than the other community next door because they might have a different pricing model, it's important to take that into consideration because you have to understand what your runway is financially so that you're not ending up running out of funds. The majority, almost all of these communities are private pay with no Medicaid support on the back end. So we have to think in terms of long-term financial health, what makes the most sense. The other thing would be proximity to family and your support group outside of a community. So if your daughter or your son is coming to visit you or helping with meds or things like that, it's very important to understand the location of the individual. So those three things are big. And then after that, I would say it's probably things like the size of the community. Do you want something bigger with more people in it and more action? Or are you looking for something smaller, a little bit more intimate, where it's a little bit more of a maybe slower pace and it's a little bit more of like a homey environment? So those are types of considerations to take on when you're looking into different senior living options.
Let's say somebody comes in and they've got all of these ideas on what it is and what it isn't. Is there any common misconceptions that you see when people are evaluating these senior care facilities?
One common misconception is that assisted living is more expensive than a nursing home. Skilled nursing facilities or nursing homes, rehabs, they are typically between $15,000 and $20,000 a month if you're paying privately. If you're not covered by the state, or if you're not there on a short-term stay covered by Medicare, you're paying privately upwards of $550 to $700 a day. People don't realize that assisted livings, which are more desirable to be in, or independent living communities are more desirable because you have your own private space typically, and it's a more home-like environment with nice chef-prepared meals and a dining room. It's just a little bit of a different quality, and that actually ends up costing basically half the price of a nursing home. So that's a common misconception to get people to wrap their heads around, that the nursing home is not cheaper than the assisted living or the senior living community. It's the other way around, even though you might have to share a room and be in a less desirable environment in a nursing home. Another common misconception would be the ability to be free to come and go as you please. There's no visiting hours in these places. There's residents who go on vacation. There's people that leave for the weekends with their family. Family can come and go as they please. This is the person's home. So it's not a facility. We like to call them communities, right? So this is their forever home. The living room is their living room. The dining room is their dining room. So the freedom and the flexibility, I think, surprises some seniors who move into assisted living and senior living and their adult children. It's really important to know that this is not a bad move. It's supposed to be a move that actually helps enrich their lives and helps to make them and promote independence as much as possible, because everything is at your fingertips. So thinking that this is a downgrade or a bad move for a senior, they're so nervous, they're so scared, they're so frightened of the unknown, but that's a very common feeling when there's change involved and a big transition in life. But this is a positive thing usually. Almost every time it's a positive outcome because we're coming from a place where the senior was isolated, was barely making things meet. The couple is working together and they're one person together but separated they struggle, if one's hospitalized or one's, not feeling well or something like that. So typically the adult children are really stressed and strained. And this is a really positive step forward for the senior and for the family overall.
One of the biggest challenges that I have is a lot of times people are being reactive. It is somebody fell, it is we're going to find a situation, and I almost feel like that's too late. It would be great to do proactive planning. What type of runway? If you were going to say, okay, there's a particular amount of time. I know there's wait lists at some of these places. It's not like you just show up and you get a bed. Is there a particular proactive runway, time horizon, or process that you'd recommend?
So I work with people who are independent in their 70s and 80s who are 2 or 3 years out. They're with their spouse, they're thinking about it. They've maybe done one downsize already, and now they're thinking about moving closer to family, and they're still independent, but maybe they had that first health scare. So someone like that, if you want to move into independent living or you want to move into a continuing care retirement community where you move in independent and you stay there through the continuum, that's something you want to do when you're still, fit and able or, alert and oriented. So when I first meet with those people and they're in their 70s or 80s, but still independent, their runway is typically about 1 to 3 years. And I tell them, don't wait too long because you're going to get to a point where you might need help. And then that continuing care retirement model, you're no longer able to do that necessarily from a buy-in perspective. And that's a whole nother level. But the point is, I have those types of clients. Then the other side of the coin is those people who do not plan and they wait for that sentinel event. And at that point, typically the runway for someone who is gone to the hospital or is at home and struggling with home care or struggling to stay safe, typically I'm doing placements in a matter of 1 to 3 months. Basically, in a month, we can go check out a couple of places, tour a few of them, have some follow-up visits, have them come and do an assessment of mom or dad in the home. And then you're talking about logistics in terms of signing a lease as you would an apartment and then moving furniture in. So it's getting a mover and getting the apartment set up so that when you move mom or dad in or you're moving yourself in, you move right into a nice apartment. But typically the normal case is somebody who's not necessarily in crisis, but they're starting to look for this. It's 1 to 3 to 6 months. If it's a crisis scenario, we're doing it in days to a month, basically. So it really depends, but it's an ongoing conversation, and you always want to have yourself kind of at least set up for success, understanding what the options are so that if you are in a crisis, you're not making any very rash or emotional decisions.
I think that's really important. I would say one of the things that we come across is Title 19. And so Title 19, applying for Medicaid benefits, at what point? So let's say you get into a care facility and they've finally been drained of your assets and now you have to go onto Title 19. Is there anything to do to be able to protect from being moved from your facility? Are you always going to be able to stay where you started? What have you come across in that realm?
So I work with Title 19 clients all the time, whether they are already on Title 19 and need a skilled nursing Medicaid facility, or they are looking to move into assisted living and they have limited assets. Maybe they have $200,000-$300,000, which that combined with their income may only last 3-4 years. We have that conversation hopefully early on. So if we understand the finances, I can help present the family with a plan where maybe there's a community that, one, they can either stay after they run out of assets. There's a couple communities around that after you run out of assets and you're on Medicaid, if you've spent down and you've bought into that community for the last couple of years, they'll support you there on Title 19. They have beds that convert from private pay to residential care. So those are very few and far between. The majority of clients go to assisted living with their nest egg, whether from their home or their investments, and over the 3, 4, 5 years, they may spend it down. What we tell families is when you have about 3 to 5 months of funds left, 3 to 6 months, or you have your last 80 grand, something like that, 70 grand, that's when you want to start putting yourself on the wait list for some of these nursing homes, maybe even earlier. So these nursing homes do have a lot longer wait lists than the senior living communities do because you're dealing with a Medicaid population and that sort of thing. So I always encourage people to put themselves on wait lists even before they go to senior living. The average length of stay in an assisted living is about 1 to 3 years. So it really depends on who I'm talking to say, is this a 1 to 3 year plan that we're looking at kind of, or can I think that this is more of a 3 to 5 year plan? Am I talking to someone who might have 10 years of funds in their runway? So it really depends. but you have to do some simultaneous planning. So it's talking to an elder law attorney, understanding the finances. If you want to protect yourself or your spouse and you're concerned about Medicaid and that draining your own assets or putting you in trouble as an adult, then again, there's a 5-year look back in Connecticut and New York. So we talk about that a lot. And Medicaid, they talk about making that a 7-year look back and things like that. So if you want to protect your assets for your loved ones or from your spouse, so that if you're, God forbid your spouse has dementia at 63, if you're doing 10 or 15 years of care for that individual, that can be hundreds of thousands of dollars over the years. And then you're still a young woman or a young man and still need to have plan for your future and your care needs down the roads. We help people to not impoverish themselves necessarily and try to really extend their assets the best as possible. So it's a multifaceted approach.
I think you just hit on why we're doing this. This is why we're building these partnership groups, because these things don't work in a vacuum. You need to be able to have someone like you that's into senior advocacy, but also be able to partner up with people like the financial advisor, like the estate planning attorney, even the accountant when making these decisions. And a lot of times these professionals, they work separate from one another. They don't speak with one another and they don't strategically plan together. So that's a reason why I thought it was really important to be able to bring you on into this group, because this is a piece of the puzzle that I think a lot of people in my industry are missing.
I agree.
Is there anything that you want to leave the audience with that we should be aware of?
So CarePatrol is a free service for seniors and their families. We don't charge anything for this service. How I feed my children and how CarePatrol is a business, we are that broker, that middleman between families and the communities that can serve them and that can provide independent, assisted, and dementia care. So it's important to know that when I'm working for a family, there's never an upcharge. There's never a charge that the senior living is going to charge more because they're working with me. If anything, a family's going to get a better deal because when I take a family to multiple communities, the community knows that they're working with me. The community knows that the family is going to lean on me in terms of advice and guidance. So they're more willing to say, okay, well, Chris is bringing them to multiple places. So they have to be more strategic and more appealing in terms of their costs, in terms of everything. So I can get better deals for families and help save some money on the front end. And also just understanding the ins and outs of these communities. I can help streamline the process. And again, there's never any extra charge to you guys. It's a free service. We're paid as advisors directly by communities. So it's really a win-win for everyone.
And you have advocates across multiple states too. So like if I got a client that lives in Florida, or if I got a client that lives in, let's say, Chicago, we can give you a call and you can set them up with someone?
Correct. We have over 200 offices. We are the nation's largest senior placement company. I've done moves from Connecticut to people who have loved ones in Wisconsin, Oregon, California, Florida. So you got it. You name it. We can help with local advice. And that's the key, is to have someone who's a professional, who knows the players, who knows the options. We can help really quiet down the noise and help provide education so that families can make the most educated decisions and feel like they are going to be in the right place at the right time, getting the right care for the right amount.
I think that's fantastic, Chris. And this is exactly why it was great to bring you on. So I want to thank you so much for your time today. I want to thank everybody who has listened. As always, please feel free to reach out if you want to learn more about CarePatrol or if you have any questions. We're always here to help. Thank you for taking the time and enjoy the rest of your week.